I'm Chris Heislip. I'm a lieutenant at the Pennington County Sheriff's Office.
My name's Deputy Romero with the Pennington County Sheriff's Office. I work in patrol. I previously worked for the Chicago Police Department for 13 years, and then I worked for the Rapid City Police Department for 3 years.
Deputies are asked to do so much and respond to a wide variety of situations, and this tool allows us to connect them with that mental health professional. Although we have training in mental health and addressing folks in crisis and de-escalating the situation, we are not specialist in those areas. And so this allows our deputies to connect with a trained specialist that are using approved medical instruments to help de-escalate that situation. Where we find telehealth helpful is in those lower level cases, especially with juveniles, in which we can address that immediate issue and the root causes and provide for some follow-up care instead of just walking away from that concern.
I did have this one incident where a grandmother called because her daughter the granddaughter was refusing to go to school, and the granddaughter appeared to be depressed. We arrived, and based on my interaction with the granddaughter, I did not have enough to do involuntary hold. After the entire interaction, they both were very happy because I'm a law enforcement officer. I'm not a trained mental health professional. Once they spoke to a professional, they felt really comfortable, and they were pretty happy afterwards with the interaction. The benefit of that interaction was it did connect them with follow-up mental health professionals. If that was not available at that time, we would not be able to do much more. We would have to hope that the crisis was temporarily averted. We would have to walk away from that situation, which we don't always want to, because we know in our gut feelings that we have would be like, maybe it's not a good idea, but we don't have enough legal authority at that point to do anything other than that.
There was an inmate at our jail that was going through a crisis but was supposed to be released, and the jail had concerns for releasing them out in public without some type of assessment. There was not a qualified mental health professional available at the time of release, and so they contacted a deputy to make an assessment. And we utilized telehealth in that situation to medically assess that patient and that inmate and provide for a safety plan prior to release from the jail.
In law enforcement, we have gotten used to seeing individuals over and over with similar or the same problem. Since using this, and it has been a benefit to reducing the number of times we interact with the individuals in crisis. From my personal experience, I have not met somebody again once I connect them to the virtual counselor for follow-up care.
Pennington County is a very large county. It goes about 10 miles east of Wall, about 60 miles north of Wall, down to the Pine Ridge Indian Reservation, and all the way to the Wyoming border. So many times it could take us up to an hour or more to get from one of those places to our facilities here in Rapid City. With telehealth, we can bring that service to them. It's an immediate response, and it's a medically based response versus just law enforcement. It will address that particular issue and avert that crisis temporarily and provide follow-up care, which we show is much, much more effective than, say, taking someone to jail where they don't belong there. They need the help. Someone in faith, what options do they have to address someone who's in a mental health crisis? They don't. They have handcuffs in a patrol car, right? And maybe someone who's 22 years old trying to solve a problem. So this gives our officers and deputies, law enforcement, a tool to address a mental health crisis with a mental health professional in a safe way. Many agencies in many areas are trying to have mental health professionals ride with the officer. Well, guess what? We have access to them 24/7 right now in a safe environment. We don't have to worry about the safety of a civilian, of a professional, an unarmed professional in these volatile situations. We have them at our fingertips, and that is most helpful.